think we got everyone from the waiting room, Mindy, if you want to kick it off.
Okay. Well, first off, welcome everyone to our Arizona Virtual Rare Disease Day 2021. My name is Mindy Burnworth, and I am the Arizona Ambassador for the Arizona Rare Action Network. And I've been honored to be part of this group for the last 3 years. And I'm excited today to be joined by approximately 50 other individuals here in Arizona to share our support and our experiences with rare diseases. So I wanted to make sure everyone had an idea of what to expect today from our virtual presentation. Number one, I'm all about unmuting and mingling and meeting each other. So I'm okay if you guys want to interject, unmute, and say something to each other. But we will move forward with doing a quick welcome from myself and many other individuals here in Arizona. And then we're going to turn the reins over to our friends on the East Coast with the National Organization for Rare Disorders. And then we will have an opportunity for each of us to reflect on some of our stories and experiences with rare diseases, and then capture how we can make things better here in the state of Arizona. Then we will have a fun Zippy the Zebra video closing. And for those of you that would like to stick around for a little hoofbeat happy hour afterwards, I'm sure we could accommodate that. So like I mentioned earlier, my name is Mindy Burnworth. I am a pharmacist by training. I'm also an educator. I'm a full professor here at the College of Pharmacy in Glendale, Arizona. I'm also a mom and a rare disease advocate. I wanted to welcome my colleague and friend from Tucson, Rare Disease Day days, to the floor to share a little bit about what is happening in the southern part of the state.
Well, thank you so much, Mindy. I feel like it's just been such a great experience meeting you and the entire rare community, and for us, Rare Disease Day it's a very important day. My name is Schmidt, and in my daytime, I'm a curriculum guy for the Vail Unified School District out here in Vail, Arizona. But our family, after our diagnosis of our son in 2018 with MECP2 duplication syndrome, we're just looking to how we could get back and advocate. We felt so alone, right? When you have your kid diagnosed with something that you feel like no one's heard of, and you're kind of searching for a community and you just can't find one. What we found is we found a lot of connection in the rare disease community. It would be someone with a similarly rare disease that would be kind of showing us the ropes and being that person that we could talk to, and that person that understood where we were coming from. So one of the things we wanted to do to support that and to support the work that NORD does is we really wanted to have an in-person event in Tucson, Rare Disease Day Tucson, with our I brought my sticker with our funky cactus, but an event where not only could families advocate for those with rare diseases, but also a place where families could connect with each other and connect with resources locally. It's an event last year we held at the local Children's Museum and had a resource fair out front. Mindy and her team were there and awesome and had some great stuff, and we thought it was just a hit. Obviously, with COVID, we're having to alter that, and it's much more of a virtual event this year, where the museum is having some virtual items that they're putting through their Facebook and social media accounts that kids can do at home, but still connect with kind of the essence of that Rare Disease Day piece. But as it's very much about advocacy, we talk a lot about inclusion at Rare Disease Day Tucson because it's such a kid-based event. So you can be any kind of kid, watching these online videos for the Children's Museum and understand more about maybe what other kids are going through. We'll also have children's clinics at Tucson doing a great drive-through where families can pick up different things to do. The really neat thing they have going there, and I know Mindy and others have heard about this, but there's a great group called Beads of Courage, and that they're using that day to kind of unveil a rare disease day bead. If you're unfamiliar with Beads of Courage, it's this great program where kids who have a chronic illness and they go to the doctor a lot, every time they go out, Mindy's got one right there. Every time they go through a blood transfusion, every procedure they have, they get a bead to represent the courage that they're showing as they go through this journey. And you see kids rolling up into the hospital with a necklace, and you just know that kid's been through a lot, but you also know that they carry that with pride, and so it's a really beautiful thing, and we're so appreciative of them making a zebra bead to represent Rare Disease Day. And we're very proud that in Tucson we're able to have it be unveiled at one of our clinics. So thank you for hosting this, and thank you for everything everyone does.
Thank you, Aaron. And I'm going to go ahead and play a quick video, a welcome video from our CEO at NORD. So bear with me one moment as I get that kicked off.
Welcome. I'm Peter Saltonstall, President and CEO of the National Organization for Rare Disorders, and would like to welcome you to our 2021 Virtual Rare Disease Day event. But before we begin, I would like to send out a special thank you to all those advocates and others who have spent so much energy and time supporting the rare disease community. So thank you. The role of Rare Disease Day is to bring together advocates and patients from around the world to help tell the story about rare diseases. There are events like this happening virtually all over this country today, and some of the audiences that we're really trying to focus on are those in the state legislatures, where advocates and legislative people come together to understand the burden of rare diseases and the impacts it can have on them, and therefore build the appropriate legislation and pathway to make sure that bills are passed that support rare disease patients. As a matter of fact, NORD's doing that in a very focused way with rare disease advisory councils. We've got them set up down in 16 states and are building them in others. I think 2021 is going to be an interesting year for us. The reason I say that is because we've just come off of a very difficult year with a pandemic that's impacted the rare disease community in a number of different ways and has really shown some of the inequities in the healthcare system. For all of you that are watching today, the importance of the Rare Disease Advisory Councils is critical to the success of being able to communicate the story and the needs of the rare disease patient community. So in conclusion, I would really like to make sure that I recognize and thank all of those sponsors who have helped us make this day a reality. Without your continued support, none of this would happen. So a sincere thank you from all of us at NORD and the patient community. Taking part in events like today's are really important to the rare disease community, and we must always remember that alone we are rare, and together we are strong.
All right, thank you everyone for watching that video with us.
Elise, I think, I don't know if it happened for you guys watching, but the video was frozen on some screens. Apologies on that. But it was just Peter moving his mouth basically that you missed. So apologies that it froze like that. Thank you.
Thank you,
We heard his words though, and he looks amazing. His picture frozen right there.
Perfect.
You'll have to tell him.
I'm sure we can get you guys the video too if anybody wants to watch it again. But good afternoon, everyone. I'm so excited to join you all. My name is Elise Patel, and I am the Western Region State Policy Manager for NORD. And we're excited to talk to you guys all today about NORD's Rare Disease Advisory Council work and share why RDACs were started and where we're headed this year. And as many of you may know, 25 to 30 million Americans are impacted by a rare disease, which breaks down to about 1 in 10 individuals. And while that's quite a few people directly impacted, we're finding that lawmakers aren't necessarily aware of the unique challenges that are faced by the rare disease community. So the solution was to form rare disease advisory councils, where a diverse group of those in the rare disease community could come together and advise state government. And this is especially important because we know that many of our healthcare decisions are made at the state level. We also see this as an enormous opportunity for the community and legislators.
All right, Elise, I don't mean to interrupt you. Can you stop sharing and then reshare the PowerPoint? I apologize. It's still on Peter.
Okay.
Sorry, folks.
Let's try this again.
I can share my screen if you need help, so.
I think what it is, all 50 states are participating in virtual Rare Disease Day platforms. And I think there's so many of us on there that we're breaking the internet.
That's a good problem.
I'll go with that. Does this work better for everyone? Hopefully.
Yes, I see your slide now. Yeah.
Okay. Perfect. Yeah, so the solution to this was really to create the Rare Disease Advisory Councils. And we wanted it to be a way that the community and legislators could come together and partner in a strategic way to really address those issues on a regular basis. The first council was created in 2015 by some wonderful advocates in North Carolina, and since then has really gained traction across the country. So on this slide, you'll see that we currently have 16 states that have passed RDAC legislation, with Massachusetts being the last state to do so just last month. And much of this progress has really happened over the course of the last 2 years, with 10 governors signing RDAC legislation into law since 2019.
Elise, you want to just stop sharing your screen? I'm going to try mine. I'm sorry.
No, it's fine. It could be on my end, so I'm hoping yours will work better.
Okay. Okay. You can continue talking and I will get the screen up in a moment.
Okay. Yeah, so NORD was excited to launch Project RDAC this past year, and this was our initiative to help really optimize the existing RDACs that are already established, and then also as a way to increase the number of RDACs across the country. And with this initiative, NORD is going to be providing opportunities for RDACs to collaborate with each other, as well as providing educational resources to guide an RDAC for every step of their journey. So you're welcome to visit our website. It's rarediseases.org, and there you can click on our Project RDAC tab. There is resources. We have all of our upcoming events listed there, as well as an interactive state map where you can view the Arizona specific information. And currently, Arizona doesn't have an RDAC. However, with your help, we're hoping to start that process and establish a council. And this would include building a diverse coalition of stakeholders from the rare disease community to make sure that everyone has their voice heard in our efforts. So if this sounds like something that might be interesting to you or that you would like to be part of, RDAC at rarediseases.org, and we're happy to connect you so that we can be part of that coalition together. And then also I would encourage you to visit that Project RDAC website I just mentioned, where you can learn more and get one-pager information as well to utilize. So next I would like to go over our state report card. Sorry.
I think I'll take it. I'll cover for you. It looks like you're having some technical issues. Sorry, Elise. I got it. Can you guys see my screen okay? Okay. Not to cut you off, Elise, but looks like you're frozen. Oops. Okay. So NORD puts out a state policy report card, and we just recently published the newest edition. This is 2020 And these are some of the issues that, or these are the issues that are focused on within the state policy report card. Medical nutrition, Medicaid financial eligibility, newborn screening, prescription drug out-of-pocket costs, protecting patients in state Medicaid programs and patients in state regulated insurance, rare disease advisory councils, as Elise just mentioned, and step therapy. I will put in the link to the actual state report card, and you can take a look at Arizona's and compare to other states as well. Since we're having technical issues, I'm not going to attempt to play this little video on navigating the website, but you can feel free to poke around the website and pull up the Arizona report card. Some things to note with the report card, it is a snapshot of issues described as of November 2020, with the exception of the rare disease advisory councils. Those were actually updated in December of 2020. Any current legislation this year that has recently passed or is going to be passed will be reflected on next year's report card. The appendices and methodology of how the report cards were graded is also listed on the website as well for you to take a look at and review, and each topic. And it's actually really interesting. This is our first year. It's an interactive online report card, but you can also highlight an area that, like, for example, the Arizona one, and actually print out a printable version of it as well for you. If you have any questions regarding the report card, you can email our policy team or connect with Mindy as well, I'm sure. But please direct any questions on the RDAC or the report card to policy@rare diseases. And again, I apologize for the technical difficulties, the world we're living in right now, right? Mindy, I'm going to pass it over back to you, and I'll advance the slides for you.
Well, Kristen and Elise, thank you for sharing an update on what is happening nationally with NORD, and then also bringing it back here to Arizona and pursuing what we call the RDAC right here in Arizona. For those of you that were kind of wondering about the report card, it's very much like a child's report card. It's A, B, C, D, or F. And while Arizona does have some F's on there, I like to think that it's first attempt in learning about the rare disease community. So we definitely are going to make significant improvements, but we already have some gold stars and A's on there. And speaking of golden stars, I wanted to introduce Allison to the podium. And she has a heartwarming gold star story. And I want her to share with us a little bit about her involvement with the rare community. Take it away, Allison.
Well, thank you, Mindy. And thanks to NORD for having me. I have one of the cute little zebras. And I like to think that we are breaking the internet today with all of the rare disease activities. So that's awesome. Looking at that photo you see on the screen, it's one of the last photos that was taken of my family, my husband Jamie and our son Travis. This was in March of 2018, and I never dreamed when that picture was taken that I would be here at Rare Disease Day on 2021. My husband was battling colorectal cancer, and we had met some friends for dinner. And my son, he just loved bringing people together. You can see, you know, he was known as the boy with the megawatt smile. We lost my husband later that month. And 5 months to the day of my husband's passing, Travis, our son, died of a rare disease that no one knew he even had. He'd never been diagnosed. And it was only, he spiked a high fever. We got him medical attention. 3 different providers dismissed his fever as the flu. It's routine. Kids get sick, kids get the flu. It wasn't, in Travis's case, routine. There's nothing routine about it. We didn't know that Travis was born without a spleen, a condition called isolated congenital asplenia that is a rare disease impacting about 1 in 600,000 children worldwide, and that would take him from us. The medical examiner discovered it, and without the spleen, Travis was vulnerable to life-threatening bacterial infections. So, as you can imagine, with what I've just shared, 2018, people still wonder. Sometimes they ask me how I'm still standing with those tragedies back to back. But I knew I had to do something. So I took that compound grief and I channeled it into making sure that I would do everything possible to prevent my pain from becoming another parent's pain, from wondering how exactly could it be in this modern era of medical miracles that no one is bothering to check children for a spleen, especially when it's so critical to their immune system. So a few weeks after Travis died, I was blessed to have to make contact with the researchers who had discovered the genetic mutation for isolated congenital asplenia. And that's how I came to rare disease advocacy. We started the 501c3 nonprofit foundation called Team for Travis. Our website's there on the screen, and it's our mission to prevent children from dying from this terrible unknown disease. So a couple of the things that I've really become involved in, and this is an opportunity, I'm so excited to be working with Mindy and with NORD to advocate at the state level. I've really been lucky. I've had meetings with federal members of Congress, our two Arizona senators and Representative Debbie Lesko. I live in her district, and next week I will be participating again in a program called Rare Across America that organizes and schedules meetings with our U.S. representatives. So one of the asks that I'm going to be making is that they support the Newborn Screening Saves Lives Reauthorization Act. And I just got news, it has been picked up and it's being sponsored in both the House and the Senate. So we'll be working to get our Arizona members of Congress on board and fully behind the Newborn Screening Act. And one other thing I'd like to invite everyone, Mindy said this was okay, so it's just a little public service announcement. On Saturday, this Saturday, February 27th, we are honored by Papa John's. They are partnering with us and they're doing a fundraiser at 33 Valley area Papa John's locations. So if you're so inclined, you can go online, check out our website, teamfortravis.org/Papa John's. And when you visit the Papa John's website and place your online order using the code GROUPRAISE, Papa John's is donating a percentage of each order back to Team for Travis to help us further our mission. And so I'd love it if everyone eats some pizza and thinks of Travis on Saturday, kicking off Rare Disease Day. Thanks so much.
Thank you, Allison. And if you want to pop in the chat your website, because I did put it in, but I want to make sure I got it correct. That would be great. Thank you.
Thank you, Chris.
And Allison, make sure I got the code correct. I put group raise.
You got it. Looks perfect. Thanks again.
So next up, we have an individual that is near and dear to my heart. She's actually one of my student pharmacists, but soon to be colleagues. And she has a very special story to share with you about her life with a rare disorder. Ashley, feel free to go ahead.
Thank you, Dr. Burnworth. And real quick before I start, I just wanted to say it's so good to see, I actually saw Allison and met Allison through the Immune Deficiency Foundation. So that shows alone we are rare, but together we are strong. But my name is Ashley Vigel. I'm a future healthcare provider and a rare disease zebra. I have a disease called primary immunodeficiency and a goal of finishing pharmacy school to one day help zebras like myself. The day of my pharmacy school interview, I told those that were interviewing me that I had a passion for advocating for rare disease. And I remember them telling me I needed to speak with Dr. Burnworth, as she was coincidentally a professor, and then also, as we all know, the Rare Disease Action Network. And I remember having to hold back my excitement that entire interview because it could possibly be one step closer to my dream. But here I am today, speaking with you all as not only a patient, but as a future healthcare provider and as my school's pediatric club president, which is the club on campus that serves both the rare and pediatric populations. However, getting to this point came with a lot of struggle. When I was a baby, I had over 12 infections a year, failure to thrive, and needed many surgeries because of infections. Doctors kept saying that it's only just an infection or that it's normal because kids get sick. However, I wasn't getting better and I was fighting for my life with each infection. It wasn't until I was 4 and with the help of my mom, who's on this chat, I'm so excited to also see my mom's name, but she's here today too, with the help of my mom's perseverance to get an answer from a doctor, and he realized he was finally hearing the hoofbeats of a zebra, and I received a life-saving diagnosis. And after my diagnosis, I started a medication called immunoglobulin, which is derived from plasma donors, or from healthy plasma donors. And although I'm lucky enough to even get an FDA-approved therapy, as 95% of rare diseases don't, it's incredibly expensive. I have to rely on the donations of others, and it's the only drug I'm able to receive to keep me alive and well. It's not like blood pressure medication, where if one choice doesn't work out, there could be another that could. Those with rare diseases often don't get choices. And when people see me, they don't see a life-threatening disease. No one will be able to tell that I take up to 2 hours of my day to infuse myself to stay healthy, or that I spent most of my childhood in the hospital, or that my biggest fear is not having insurance to cover my expensive medication. I believe that today is a day of celebration with how far the rare disease community has come. But there's still so much that needs to be done, especially within advocacy. And I believe with advocacy, there is hope for rare disease to receive more timely diagnosis and better access to medication therapies. Thank you.
Ashley, every time I hear you tell your story, I just get little goosebumps. So Ashley mentioned that she was the president of a pharmacy student organization here on campus called Pharm Peds. And we have another member of Pharm Peds that will be presenting on behalf of the rare disease community coming up here shortly. But before we get there, I wanted to introduce an individual that I recently met. And he has a passion for advancing awareness about Snyder-Robinson syndrome. And Colton is a future physician, and I'm sure he's going to be instrumental in kind of incorporating precision medicine into the story of rare diseases. Colton, go ahead.
Hello, my name is Colton Zeitler. I hope this volume is okay. I've been told that I have a very loud voice, so let me know if it's too much for anyone. Okay, all right. So hello, I'm Colton Zeitler. I'm a first-year student for the Arizona College of Osteopathic Medicine, and I've been working with the Snyder-Robinson Foundation since 2015, back when I was a sophomore at GCU. We've been working on a natural history study, and for those that do not know, a natural history study is a way that we can look at the progression of illness across multiple different patients. We look at things like consultations, we can look at things like medical records, and the goal of our study is to take something that's rare, like Snyder-Robinson syndrome, which has only had about 100 confirmed diagnoses in the last 50 years when it was first characterized. We're trying to use this study as a database or as a baseline to not only enhance advocacy, but also share this information with researchers to hopefully maybe one day create a treatment. As of right now, there is no cure or treatment for Snyder-Robinson syndrome. It's incredibly rare. And one of the issues with Snyder-Robinson syndrome is just getting a diagnosis. That's one thing that we're hoping that our study kind of solves for us, is not only putting all these different presentations in one collective area, but allowing us to pick up patterns. And one thing that I hope physicians can take away from the future as genetic and genomic research continues to advance is to utilize that technology that we have, of course, to confirm a diagnosis, but also be more aware of the zebras, be more aware of these different presentations, be more aware of the non-classical presentations. With something like Snyder-Robinson syndrome, it's a condition that affects multiple body systems, and a lot of the time, a lot of our patients and their families, they were going without a diagnosis until genetic research caught up with us, and we were able to actually confirm those diagnoses. And until that time, they were living under this false assumption that, okay, I have a completely different disorder and the treatment for that disorder isn't working. And it became very heartbreaking for a lot of the parents whose children had this disorder and weren't able to get those answers. So using that, we are hoping that our natural history study not only impacts families that do have SRS kiddos, but also allows us to push forward that kind of legislation and advocacy for other disorders around the world. So thank you for your attention.
Well, Allison, Ashley, and Colton, thank you for sharing your experiences of kiddos with rare disorders. We have another special guest, Brandy Flores, who will be sharing with us some support and advocacy advances that we are seeing on the forefront of research with our pharmacy industry. Brandy, go ahead.
Hi, Mindy. Thank you so much. My name again, Brandy Flores. I work in Alliance Development for Pfizer in Arizona, and I live in Phoenix. So first and foremost, the rare community and rare disease access to care is a priority at Pfizer. In my role, I work with the rare community to educate on public policy issues that impact patients' access to care. And I have to say I've been a rare advocate long before I joined Pfizer from my background in prior professional roles. So I know from that experience that lack of awareness of rare diseases and disorders and the diagnostic odyssey of going without an accurate diagnosis for many years are unique issues that disproportionately impact the rare disease community, and even things like disparities in geographic access, depending on where you live, can be challenges for the rare community. So Pfizer supports efforts that build awareness of the issues that rare patients face, and so we applaud NORD's efforts in particular on the Rare Disease Advisory Council efforts. Those are a fantastic tool to get rare disease patients and their families' concerns, issues, and priorities in front of policymakers, and help educate on the issues where lawmakers are on a daily basis dealing with a whole variety of different policy concerns, and they may not know if a particular issue impacts the rare community. And the formation of RDACs can help support those efforts to educate and raise awareness for rare. So I will keep this short and sweet. I care about rare. I'm proud to be here, and I know that although individual diseases are rare altogether, this is a very significant population in Arizona and nationwide and in the world. So I look forward to all the continued good work from NORD in Arizona and with the rare community on RDACs and many other issues. So thank you for allowing me to introduce myself to everybody.
So you'll have to call me the advocacy nerd. I get super excited when I hear stuff about policy and ways that we can advance support for our rare disease community. So on the coattails of Brandy's expression of support for the RDACs, we had invited two of our Arizona representatives, Representative Kelly Butler. For those of you that do not know Kelly, she is LD District 28, which happens to be my legislative district. And for the past 3 years, she has attended all of our Rare Disease Day events that have been held down at the Arizona State Capitol. And she's been very supportive of the rare disease community. In fact, she is slated to read our Rare Disease Day proclamation on the Arizona House floor at the close of business today. So you might be wondering, it's 4:30. Are they not done with their business yet? So they actually were on the House floor until late last night, and they didn't start their morning until about 10 a.m. And they have been on the House floor debating and passing policy. And she just texted me, and I'll read her text message that she sent to me. She says, I'm actually on the House floor voting in the third read. During the third read, so all bills have an opportunity to be reflected and discussed 3 different times. But during the third read, this is when the official vote happens. So she's not able to leave the House floor. But she says, Happy Rare Disease Day. Thank you for your continued advocacy. So I know that Representative Butler's spirit is here with us, even though she may not be able to be virtually here. I did see a cute little picture of her on the House floor, and she has our little zebra icon sitting at her House desk right now. So if she happens to text me before our 5 p.m. close, we will definitely hear a few words of wisdom from her. And the next invited legislative guest is Christina Coriari. And the Arizona Rare Action Network had the opportunity to meet Ms. Coriari in person 2 years ago. And that was when Christina, as the senior policy advisor, or I like to call her the first in command right after Governor Doug Ducey, she invited us to the private conference room in the governor's office, and she actually read the Rare Disease Day proclamation out loud to over 50 members of the rare disease community. So that was pretty amazing for us to have that opportunity. And this year, with the pandemic going on, you can only imagine that she was booked solid with various meetings. So while she was not able to be with us in person today, she does share her support of the rare disease community as well. And while she's not able to read the proclamation for us, we have another first in command, Priscilla, who will be reading the proclamation coming up here shortly. So Kristen, I don't know if the slide sharing stopped on your end, but I'm not seeing it anymore.
I'm going to work on getting that back up for you, Mindy. Sorry about this. I appreciate everyone's flexibility.
Well, I feel like the sun is trying to join in on our virtual webinar as well. Here in Arizona, we know that it's super sunny, but on the East Coast, I think you guys are still trying to unthaw, right?
It is dark over here.
Okay. Well, next up on the agenda is where we have the opportunity for all of us to unmute and meet and mingle. And what we would like to have the opportunity to do is, knowing that we would love to be able to facilitate a rare disease advisory council here in Arizona, The goal of the RDAC is to bring together healthcare professionals, individuals living with rare disorders, and their caregivers into a group of thought leaders who are able to identify some successes and also barriers to rare disease diagnoses, treatment, and support right here in Arizona. So the first thing that we need to do in order to advocate and bring forward RDAC here in Arizona is to learn frontline and from kind of a grassroots perspective. What are the barriers that current rare disease patients and their caregivers are experiencing here in Arizona? So with that, I invite you to unmute yourself, and if you could maybe limit your comments to about 30 seconds or a minute so we can gather as many as possible, and then be able to kind of have almost like a starting point or a platform for us to create solutions. And Ashley, maybe I'll put you on the spot here. Do you want to start the reflection on barriers and how we might be able to overcome?
Ooh, that's a good question. And I think it's a question that I've constantly been thinking about as a patient, as even with today, I have barriers of with getting medication, even diagnosis of an infection. If people are unaware with immunodeficiency, sometimes I don't get a fever when I get an infection. There's been times where I was at Phoenix Children's Hospital and I was in the emergency room and my mom knew there was something wrong, and I had a double pneumonia, but they didn't want to admit me because I didn't have a fever. So barriers, sorry. I think bringing more awareness and bringing more advocacy that there are not the usual cases could help healthcare professionals are understanding that there's more that they don't know, and to be aware of the rare and understanding that it's okay to not know what you don't know.
Ashley, thank you for being very honest and frank with us. I know we have several other members of our rare disease community present. Maybe Sharon, could I call on you next? I know you've been able to participate in many events.
Yes, hi everybody. My name's Sharon Lagas, and I am the co-founder and past president of the Alport Syndrome Foundation. Alport syndrome's a rare kidney disease, and it affects 3 generations of my family and 6 family members. We were pretty much all diagnosed at once. It causes kidney failure, hearing loss, and vision problems. I would say, and you know, I'm a patient as well as a caregiver. So I would say the biggest barriers that that we've encountered is, one, getting a correct diagnosis, which we're lucky in that there is genetic testing for Alport syndrome, but unfortunately, right, access to genetic testing is difficult and is often not paid for by insurance. And it's shown that that is actually, you know, the most accurate way to get diagnosed. I would say medication, getting access to medication is a barrier, particularly if it's a new medication, of which Alport syndrome has no, dedicated treatment. There's been no approved treatment by the FDA for Alport syndrome. And then last, I would say we've encountered the same difficulties as Ashley with getting the medical expertise here in Arizona, because you don't only need a kidney expert, but you need other experts as your disease progresses. So I would say those are some of the barriers that that we've encountered. Thank you.
Sharon, thank you for sharing those perspectives as well. And I know in the chat earlier, there was a reflection from one of our participants, Lisa, and I was hoping that she might feel comfortable sharing with the group and maybe some of the barriers that she's been experiencing.
Hi, can you guys hear me okay? Okay, my name is Lisa Becker. I have 16 rare or unusual diseases, including hypophosphatasia, mast cell activation syndrome, and Ehlers-Danlos. And I think the biggest barrier, I have a lot of GI diseases as well, and I've been turned away by numerous doctors who said I'm just too sick. I'm outside their scope and they can't deal with me. I think that one of the barriers my doctor and I have talked about is there isn't any continuing medical education and seminars that doctors can go to that educate them about rare diseases. So maybe that's something, you know, that and the other thing is the cost of living goes up, but they don't raise the cutoffs for help for assistance in this state. So it's still the same as it was like 10 years ago. So just those two things. Thank you.
Lisa, thank you for sharing. I know I've been able to kind of invite several individuals to the podium, but I know that there's many others on the line that may want to share their perspective. So feel free to unmute yourself and join in.
Hi, everyone. I'll join in if you don't mind. My name is Susie Dyer. I'm with CFC International. I am the executive director. CFC International supports cardiofaciocutaneous syndrome, which my 7-year-old son has. I have an interesting perspective, I think. I grew up in a southern state, and I moved here from a southern state. And so when I moved to Arizona 2 years ago, services actually improved quite a bit for us. So our perspective is maybe a little more optimistic at this point, but I think also we still obviously face some challenges, and those challenges really equate to access to the right medication for our son. He has seizures, and we've had some varying degrees of access to specific seizure medications that have created some barriers for us. The other piece, I think, would be educational, access to educational needs for our child as well, because CFC syndrome does have comes along with a developmental and intellectual disability. It is, we've seen some challenges in the services at the educational level and progression, obviously, with COVID-19. So I think those are the things that probably are the most frustrating for us. But like I said, it's a little bit sunnier over here in Arizona in a lot of ways. So we appreciate that.
Well, welcome to sunny Arizona. So, Kristen, I feel like we have covered, I've taken some notes, and we have definitely some areas that we can use as a springboard. Were there any other specific questions that you wanted to ask, or should we move on to the positive side of rare awareness?
I think that was some great conversation, and I'm fine with moving on to the positives now.
Okay. Well, this, I feel like we'll be able to celebrate some of our successes that we have had right here in Arizona, and then even across the nation. So I don't know how many of you knew, but in 2018, the Empire State Building was lit up in the Nord colors, green, pink, blue, and purple. So this year, we did request that Governor Ducey light up the Arizona State Capitol, and we got our request in just a little later than anticipated. But the positive thing is now I know how to do the application, and next year we'll all be able to go down to the state capitol and celebrate it lit up. I'm running into the challenge that they may not have the ability to do 4 colors. They said they might only be able to do 3 colors, but I was still happy with 3 colors. But right here locally in the Glendale area, Midwestern University, we are an interdisciplinary healthcare campus, and we celebrate rare diseases annually here on campus, and President Geppinger has allowed us the honor of lighting up our saguaro cactus here on campus. It will be a singular blue color, but there will be a special message from the president sharing that the reason the cactus is lit up is because of rare disease, kind of promoting awareness within the medical community. So one of the other successes that I'm just excited to be able to kind of pass the stage over to Priscilla is the signing of a Rare Disease Day proclamation. So if we can advance to the next slide, and I will let Priscilla share her perspective about being able to receive this amazing proclamation. And go back 1 slide, please. There we go. Go ahead, Priscilla.
Hi, my name's Priscilla, and I'm a pharmacy student at Midwestern University in the Glendale campus, and I'm also the philanthropy/rare disease chair for our pharmacy pediatric club. And one of my roles was to submit a request for Governor Doug Ducey to say that February 28th, 2021 is proclaimed as Rare Disease Day. And I actually have the proclamation here, and if you can see that there's this gold symbol here. And I'm going to go ahead and read it out. Whereas according to the National Institutes of Health, there are nearly 7,000 diseases and conditions considered rare, each affecting fewer than 200,000 Americans in the United States. And whereas while each of these diseases may affect small numbers of people, rare diseases as a group affect almost 30 million Americans. And whereas many rare diseases are serious and debilitating conditions that have a significant impact on the lives of those affected, and whereas while hundreds of drugs and biologics have been approved for the treatment of rare diseases according to the Food and Drug Administration, or the FDA, millions of Americans still have rare diseases for which there is no approved treatment. And whereas individuals and families affected by rare diseases often experience problems such as diagnosis delay, difficulty finding a medical expert, and lack of access to treatments or ancillary services, and whereas while the public is familiar with some rare diseases, such as Lou Gehrig's disease, and sympathetic to those affected, many patients and families affected by less widely known rare diseases bear a large share of burden of funding research and raising public awareness to support the search for treatments. And whereas thousands of residents of Arizona are among those affected by rare diseases, and whereas the National Organization for Rare Disorders, or NORD, is organizing a nationwide observance of Rare Disease Day on February 28th, 2021, and whereas thousands of patients and caregivers, medical professionals, researchers, companies developing orphan products to treat people with rare diseases, and others in the state of Arizona will participate in that observance. Now, therefore, I, Douglas A. Ducey, Governor of the state of Arizona, do hereby proclaim February 28th, 2021 as Rare Disease Day. And I'll go ahead and I'll show this again. And thank you.
Priscilla, thank you for your efforts in submitting the paperwork to request the governor to sign this special proclamation. And we had the honor of Senator Bartow actually reading our Rare Disease Day proclamation on the Arizona Senate floor this afternoon. I did take a quick virtual video of it, so I'll make sure that I get that shared with our participants today. And Aaron kind of alluded to a special group earlier called the Beads of Courage. So we have the founder of the Beads of Courage with us today. So I want to invite Jean to share a little bit about Beads of Courage and some of the celebration and activities that you will have coming up this weekend.
Great, thank you so much. I'm so excited to be here, and again want to extend gratitude to Aaron Schmidt and his wife for bringing Beads of Courage into the fold of rare diseases and awareness around rare diseases. I know that our organization, we're based in Tucson, but we support children throughout the United States and the world through our flagship program, which is called Beads of Courage, where we give beads that serve as visual and tangible symbols of their courageous journey. We believe every bead tells a story of courage, honor, and hope. And it's fun knowing that Mindy is a pharmacist, and we have a couple PharmD candidates. My background, I'm a pediatric oncology nurse, and I created Beads of Courage after recognizing while caring for children that while I felt confident to care for their physical needs, what was missing from my practice was recognizing and honoring the courage that I would bear witness to each and every day. And so I was seeking a way to recognize their courage in a very tangible way. So I like to tell our clinicians that implement Beads of Courage now in 150 children's hospitals throughout the United States that every bead they give is a dose of narrative medicine. So while we're giving medication that helps with any condition or the treatment, I believe that every bead Beads of Courage gives provides that strength and that recognition of their courage that keeps the human spirit strong in very challenging circumstances. So it's with great honor to share with this exclusive group tonight that we have created a new bead that will now become part of Beads of Courage and every dose of narrative medicine that we give with a zebra bead. And so we revealed that recently on social media, and the first children to receive the zebra bead will be on Friday at children's clinics here in Tucson, Arizona, where we'll be launching the Beads of Courage program there, which I'm very excited about just from my own practice as a nurse. I know a lot of my patients will continue to receive expert care at children's clinics. And we've made an announcement to our network of hospitals throughout the United States that the zebra bead is now available to them to order from our headquarters and can be provided to their patients they know deserve the honor of being recognized for their courage and giving them this special bead. I would like to make the bead available to everyone as well as part of tonight. If you email me and just drop me your name and address, I'll send a care package in the mail to you with your own zebra bead to gift on with each of you. So every bead we give at Beads of Courage is packaged individually with an intention card, which we collaborated with Nord. So the card, when you open it, shares a message from both our organizations about the significance of this bead that we give, as well as shares the message of what the zebra symbolizes to the community. And I had my daughter make me a bracelet right away with my zebra bead. So I noticed I'm the only one showing my stripes tonight. So I have all my rare disease flair on. I got my stripes and my zebra bead. So please, the main message too around advocacy for quality of life and emotional support is that our organization draws no eligibility criteria for a child to receive Beads of Courage. So if you take away a message from tonight from Beads of Courage, it's one, we're here to support the emotional needs of children and teens and people living with rare diseases. You can simply email info@beadsofcourage.org or visit our website. We currently mail beads to over 3,000 children that we know are not receiving Beads of Courage at their hospital where they receive primary care. And we know that that's a direct reflection of the leaps and bounds we still need to make for inclusivity around quality of life and psychosocial programs, regardless of the diagnosis that we are here to support. So please pass the message. If they email I will expedite their enrollment in our Beads in the Mail program. And email me to get your zebra beads so you can have your flair.
And who doesn't need more zebra flair, right? So speaking of swag, All of you tonight will be entered into potentially being the recipient of Nord's swag bag. So looking at this, we have fun striped socks. We have, of course, the iconic zebra, Zippy the zebra on here, and then a face mask. So after the close of the presentation, I will use our fancy online platform to do a randomization and be waiting for an email or a phone call from me. And then we will get the swag bag mailed out to you. So with that, we are nearing the close of our virtual Arizona 2021 Rare Disease Day. Before I close, I know we have a special video message from Nord's Zippy the Zebra.